It's important in somatic coaching that we begin to look at what we call psychological red flags. These are certain symptoms and issues that come up with people, and if you're not trained as a mental health provider, that it really is beyond the ken of this coaching. And so what we can look at here is depression. And depression will show up as like a lack of interest, sleeplessness, crying jags, a general malaise that's happening with somebody, and that they feel mobilization is really, really decreased, and they don't see possibilities. A chronic anxiety that will show up as a sleeplessness, maybe an upset GI tract, hard to be present, always vigilant about what might go wrong, are very uncomfortable with any kind of uncertainty or interruption in order at all. They show trauma symptoms, a hypervigilance, startle response that is very chronic, and there's a affective numbing, very difficult for them to feel themselves, a very strong sense of armoring about things, hyper arousal, and they can fall into a disassociated state. Any kind of excessive compulsive behaviors, overeating, undereating, excessive drinking, excessive drug use, recreational drugs, but also prescription drugs, especially opioids now, gambling, sexuality, self-harm behaviors. This is where people are cutting themselves and they're putting themselves at risk. Those that are starting to get moved towards violence, doing harm to others, physical, verbal, emotional violence and aggression, picking fights, threatening to hurt others, having a psychotic episode. This means that they're completely out of touch with reality. This can be hearing things that they're just hearing inside of their own head, seeing things like hallucinations, and building often paranoid scenarios and narratives that send them into flights of fear. Often there are precursors to these kinds of events, and we can pay attention to these precursors and see if people have adequate help, to see how chronic they are, see if they actually have a support system around them. These things can include job loss or job change, that family and relationships are in jeopardy. Maybe there's a separation, maybe there's a divorce, maybe the children, something is happening untoward with children, or children are leaving the house. Chronic stressors that can be happening inside the family with a child, with a relative, or with a co-worker that they become more and more obsessive about. Loss of a loved one. This could be either through dying, death, or then moving away. Caregiver strain, aged parents or a disabled family member, and the toll that takes on the client. Chronic and terminal illness. This could be happening to the coachee or to one of their loved ones. These are often the precursors to these psychological red flags that we have, and we want to pay attention to that and recognize our own limitations in dealing with that, and have a network of help, people that are trained to deal with this, that we could refer them to. They could go fully into that person's care, or you could work hand in hand with that person.